Welcome to Dr. Osborne's Zone. Today, we're talking about muscle versus medicine. When you build muscle, you balance hormones, and we're going to talk about the science behind this important topic. This simple change, one simple change you could make. Aristotle was quoted once for saying that life is movement, and movement is muscle, because muscle provides that movement. Now, if we look at some general statistics here, you can see here, 2013, the decision of the American Medical Association to recognize obesity as a complex chronic disease that requires medical attention came as the result of developments over 3 decades. Now, I know I'm probably talking to a lot of you who may get upset about this, but obesity is an illness, and it's an illness of choice largely. Many people don't realize the choices that they're making are leading to obesity. There are a lot of things that can contribute to being overweight. There are chemicals in our food, pesticides, dyes, preservatives, additives. Sometimes these chemicals collectively are referred to as obesogens. Then we're also exposed to a tremendous variety of different processed foods that are calorie malnourished, meaning they're basically calories without vitamins or minerals, and that too can contribute to obesity. We live in a society where everyone is okay with Netflix surfing. We also live in a society where it's socially acceptable for tech to rule our lives. You know, you go to work and you sit at a computer screen with a hunched over posture that can affect your muscle mass, your weight loss, your oxygenation, can cause obesity and weight gain. We're in a binge TV society where you can now downstream movies or you can binge watch seasons of shows. You know, all this leads to sedentary behavior and sedentary activity. You can see here we've got policy failure across our governments. Many of our governments don't acknowledge obesity as a crisis, don't acknowledge the loss of muscle mass. As a matter of fact, many schools have eliminated PE, physical education requirements altogether, de-emphasizing the importance of physical activity. And again, the outcome of physical activity is building muscle. Very important to understand that. Now, if we look at this next slide, from a cost perspective, I think it's super important. If all U.S. individuals were physically active to the level recommended to the Secretary of Health and Human Services, that's 240 minutes of moderate to vigorous exercise per week, then a significant portion of the annual $150 billion in direct healthcare costs as a result of inactivity could be saved. Now, this was published in 2009. We spent $4 trillion last year on healthcare. Many of these diseases could be resolved or partially resolved as a result of people doing activity and building lean muscle mass. Now, ladies, if you're watching, this isn't a bodybuilding show. We're not here to try to promote that you go out and build huge muscles and, reduce your feminine capacity. We're really talking about building simple lean muscle. Again, this recommendation is 240 minutes of moderate to vigorous exercise per week. That's less than 7 hours of exercise, actually about 6 hours of exercise a week, so less than an hour a day. Now, how many of you doom scroll on your phones? How many of you spend more than an hour a day in front of a computer screen or watching TV? Take that into context, because less than an hour a day per week, in total 240 minutes, could lead to significant impacts and changes. And again, from 2009 numbers, $150 billion in direct healthcare costs saved. Now, I think the number is much higher. I think if people had lean muscle mass, we would cut the budget, the health budget, by trillions of dollars, because at this point, what have we done? Beyond 2009, we socialized healthcare. We've said that healthcare is a right and everybody deserves access to healthcare. I don't disagree with that, but I also think that healthcare should be defined as prescribed exercise. Doctors are so busy writing pill prescriptions. They're so busy telling patients, take this, have this injection, get this shot, and they're not facing the 10,000-foot elephant in the room, which is the obesity epidemic. People are overweight. Most of the diseases, cardiovascular disease, stroke, diabetes, autoimmune disease, could all be tremendously influenced as a result of some simple prescribed exercises. And insurance, if we're going to say that everybody's entitled to health care, insurance should cover exercise before it covers any medications. In other words, a doctor should be able to prescribe exercise and not drugs, send that patient home for 2 to 3 months and see the outcomes of the benefits of what exercise could achieve. The exercise benefits that would allow for lean muscle mass growth. So why does muscle matter? Let's look at just some of the benefits here. Number one, it predicts the quality and quantity of life. Many scientists have looked at what are the best predictors of longevity and of quality of life, and those are strength-based numbers. Muscle density, muscle mass percentage, as well as grip strength are some of the areas in research that reflect that muscle strength can predict your length and quality of life. Maintenance of muscle maintains functionality through the life cycle. How many of you, you're maybe above 60 years old and you've got grandkids and you can't get down on the floor and you can't play with them because you can't get up off the floor unassisted? This is quality of life. How many of you would like to go on hikes with your family but don't have the ability to do that? This also is quality of life. Physicality, movement is life. If you lose your capacity to move and you're sitting in a chair or you're immobilized in a wheelchair or in some other type of walking device because you've just neglected your physical activity, shame on you. But let this be a wake-up call. Get to it. You can start exercising, and I'm going to show you the research is very clear. People in their 60s, 70s, and 80s can begin exercise programs and reap tremendous benefits from them. Now, additionally, muscle communicates to your organs with powerful medicinal benefits. We're going to dive into muscles as endocrine organs. They make hormones and other chemicals that crosstalk to your organs for benefit. Muscle, obviously, most people are aware of this, but it affects bone health and density. How many doctors write prescriptions for bone-building drugs in today's world before they prescribe exercise to their patients? And these drugs are to the tune of millions and millions of dollars, and they don't help. They don't work. All they really do is increase the long-term risk of fracture. So here we are in a socialized medicine capacity, spending money on products for patients, being prescribed to patients, and we're not getting our money's worth because these products don't work. Long term, people's lives aren't emboldened or bettered by pharmaceutical changes. They're emboldened and bettered as a result of taking action into your own hands. Build that muscle. We know that muscle affects intelligence. These studies have been performed in schools where when you have physical activity for children versus not, kids that exercise on a daily basis as part of their school routine perform consistently better across testing and across behavioral patterns. So improvements in intelligence. We know that muscle affects detoxification and circulation. Your body's lymphatic system, this is what cleans your blood, doesn't have a pump except for your muscles. And if you're using them, you'll detox better. We know that strong, lean muscle communicates through prejudice. And what do I mean by that? Everybody's prejudiced. They don't care if you say you're not prejudiced. We all judge. We all judge by look at first glance. And so what do? When we see somebody who's lean and in good shape, what does that tell us subconsciously, immediately through prejudice? That this person has self-love, they have dedication, they have discipline, they have capability, and they have a sense of personal responsibility. What a great society to live in. Imagine if we all could look at one another and prejudge those types of traits and qualities. Wouldn't that be great? I think exercise and building muscle brings that to the table.